A shocking case out of Kerala has stirred up national outrage. 34-year-old Asma has died during childbirth in Malappuram. Her husband Sirajuddin, a YouTuber and a self-styled orthodox cleric, chose to conduct a home delivery. Basically, carry out delivery process itself at home, and this was not the first one. Multiple kids, she's had multiple kids as well, and all were done at home. And it seems like this delivery failed for Asma. He allegedly refused to take her to the hospital. Asma didn't survive. She passed away when she was, in fact, we hear that he tried to hide this entire thing. Sirajuddin, a YouTuber and a self-styled orthodox cleric, he chose this home delivery method, allegedly refusing to take her to the hospital, and eventually she succumbed. He's now been arrested, but this isn't just about one man's action here. This tragedy has exposed a dangerous underbelly, the disturbing trend of unassisted home births in parts of Kerala, especially in the northern districts. And let me be sure here and tell you, this is not just a conservative problem. It could be a modern day problem as well. Home birth seems to be increasingly popular, many of them not monitored by doctors. It could lead to such fatalities. Kerala government now has decided to crack down strongly against such unscientific and risky practices. In fact, Health Minister Veena George has directed authorities to track and monitor these reports of home birth.
That woman was in a serious condition, and the persons who were around her, seeing that she is in a very serious condition, they didn't take them to the hospital. Even it can be observed as a criminal activity. So it's very unfortunate. So we are taking it as, quite seriously.
Now, Kerala Government Medical Officers Association has gone so far as to call unassisted home deliveries a criminal practice. To put things here in perspective, Kerala sees nearly 3 lakh deliveries a year, while the overwhelming majority take place in medical facilities. Around 500 babies are still being born at home, often without any trained medical expert or help. So why is this happening? Who is driving this misinformation? And more importantly, how do you fight it? Of course, this is happening in conservative households, and it's an illegal practice, let me warn you. But we're also looking at this becoming a more modern day practice. Joining me live is Dr. Sulpi Nohu, National Convener of the Indian Medical Association and former State President of IMA Kerala. Sir, thank you very much for speaking to News 9. What is your first reaction when you're looking at a tragic case like this? And is this a part of a wider pattern that you see in Kerala?
No, definitely. It's a very, very shocking and very unfortunate incident which has happened here. Basically, our maternal mortality rate, that is the death rate among pregnant females or maybe after a delivery, it's actually comparable to any international standards. It's only 19. But at the same time, in some part of the state it has happened. It's not the first case. It maybe there are other few cases also in past few years. Very, very unfortunate, and I think it must be dealt very, very strongly with aggressive legal measures as well as with awareness campaign. We need very very strong awareness among some parts, and definitely it's not there is no religious compulsion or religious thought process in which we can do delivery at home. It's not a practice in Kerala. A majority, as a majority goes to the majority of the people, they take hospital care, and that's the pattern here. But unfortunately, this thing has happened, and most alarming is that such trends spread by the social media, especially in YouTubes and WhatsApp and all.
Doctor, I was just about to say, the man you see on our screens here is a YouTuber himself. So he kind of pushes this method and orthodox medical practices on his platform. I honestly haven't seen it myself, but I hear that he was so rattled about losing his wife, he tried to bury her secretly. So this is hardcore criminal practice in nature.
Absolutely, it's a planned murder. We can say that the lady was bleeding for almost 4 or 5 hours, and he did not take that patient to the hospital, and he tried to do other things instead of reporting it to the hospital and taking her to the hospital. Very, very unfortunate, and It must be, there is the problem is after listening to so much things in the social media, the people and some part of the very educated people also, they think that they say that the pregnancy, delivery, everything is a physiological process. So why not in why not in why not at home? The thing is, there are very good data which says that at the time of freedom, I mean, maybe in 1947 and 1950s, the death rate after delivery was around 2,000, and now it has come down to 19. So compare it is much less than in any other.
We've made huge progress, but just the fact that Kerala has one of the finest health indicators in the country, the fact that this news is coming rampantly from a state like Kerala, which otherwise has great health facilities, healthcare system itself is affordable and robust. A case like this certainly disappoints us. Well, we know that the cops have initiated a case and they are now very closely looking into such cases, and if at all they find one, remember, this is criminal in nature. They're not spared, they're arrested. Kerala government has been very clear on cracking this down and warning people not to carry out home deliveries anymore. Thanks very much, Doctor, for joining us on that.